Right, so in this discussion, we're going to look at the physiological changes that occur during pregnancy. So you may be asked to explain, to state, to outline, describe, maybe say 5, describe 6, describe 4. The number changes, but usually it's a lot. Describe so and so number of changes that occur during pregnancy, physiological changes. So the trick there is to examine the marks allocated to the entire question. So for example, you're given describe 5 physiological changes that occur during pregnancy, and it's given maybe 20%, meaning you take that 20, divide it into 5, that gives you 4. So each change that you're going to talk about, you're expected to score a maximum of 4 points. Then 4 times 5 gives us 20. Or they can ask you, describe 5 physiological changes that occur during pregnancy, and marks allocated is 25, marks allocated is 15. You can easily do the math and you know the amount of information that is needed per change that you raise. So, during pregnancy, changes occur in almost all systems to accommodate this new organism that is growing, the baby, the fetus. So it's important that you at least touch on various systems. So there will be changes, of course, that may occur in one system. More than 5 changes can occur in one system, but that will not give you all the marks that are needed. For example, if you explain only changes that occur in the reproductive system and ignore the other systems, so you produce 5 changes of the reproductive system and expect to score 20. That's not the way it works unless the question specifies like that. But if it's open, then pick from different systems. So all the systems, namely the reproductive system, will undergo some changes: cardiovascular, endocrine, skeletal system, digestive system, respiratory, urinary, central nervous, as well as integumentary system, which is the skin. So we can start with the obvious, which is the reproductive system. Beg your pardon. So what is important here is to mention which organs you're discussing. So subheading, you say physiological changes during pregnancy. Number 1, you can say reproductive system. So you don't have to exhaust all the changes that occur in the reproductive system. You don't have time for that. Remember, if the max is 20 and then you ask to raise 5 changes, so each is only a maximum of 4. So the title itself is enough. Reproductive system. Maybe you're given 1. The remaining 4 will be from the points that you're going to show those changes of the reproductive system. So you can pick any part of the reproductive system, okay? Mainly starting with the uterus. Because as pregnancy, the size of the uterus will change. The uterus will grow in size depending on the gestational age. So this is consistent with the gestational age of the fetus. So roughly the uterus in a non-gravid state is just like the size of the fist, weighing around 60 grams or so. It's quite a small organ, but during pregnancy it grows and grows and grows and goes all the way up to 900 grams, almost a kilogram in terms of weight. So the size increases. The position of the uterus changes as well. So the uterus is a pelvic organ, but during pregnancy, because the size of the fetus is increasing, the size of the uterus is increasing, you find that the uterus seems to shift from the pelvic cavity entirely, and part of it enters into the abdomen. And as the pregnancy grows, it becomes actually an abdominal organ. Of course, the cervix and the lower segment of the uterus will remain in the pelvis, but the fundus and the body will be lying in the abdomen. So that's one. Then in terms of still on position, because the uterus is said to be leaning forward, antiflex, antiversion. That's the natural position of the uterus. Antiflex meaning flexed anteriorly, then inverted forward. Okay, so it leans like that and sleeps on the bladder. So underneath the uterus is the bladder, and on top of the bladder is the uterus. But during pregnancy, the uterus erects or stands upright, if I can put it that way, then shifts slightly to the right. Shifts slightly to the right because the colon enters in the pelvis from the left side. So on that side of the body, in the pelvis, you're going to find the colon, the sigmoid colon, rectum, and so on. So shifts a bit to the right to accommodate the colon. So that's just on the uterus. Size, position, weight keeps on changing according to the gestational age of the baby. Then we can also look at the vagina itself. So you find that the muscles of the vagina hypertrophy. So this is in response to stimulation by estrogen. Okay, so the vagina mucus also thickens, and you find that the discharge changes also. The vaginal discharge changes, the amount increases. Even though we are calling it vaginal discharge, this is just removal of the top layer of the epithelium that covers the vagina, the stratified squamous epithelium. So that process where there's increased shading off of the superficial layer of the epithelium or the mucosa of the vagina is what we call leukorrhea. Leukorrhea, a thick discharge that will be coming out from the vagina. Okay, so the muscle in the muscle layer of the vagina increases, so the thickness of the muscles increases, and the discharge also increases. If you look at the breasts, which are part of the part of the reproductive system, remember in females, the breasts are part of the reproductive system, so there will be changes that will occur in the breast. Again, this is hormonal activity, so nipples enlarge, the areola increases, that dark region around the nipple increases. Then the Montgomery's glands or tubercles also increase. There are small glands around the areola, so increases in size, and you may see some discharge once in a while from the breast. This is in response to stimulation by estrogen and other hormones of pregnancy. So we've talked about vagina, breast, and cervix. That's enough under reproductive system. Then you move to the next system. So we can't raise 5 points just on reproductive. Pick another one. So we can look at the endocrine system, because pregnancy, of course, is regulated to a larger extent by the endocrine system. So hormonal production increases during pregnancy. Most of the hormones production increases. Next is that the pituitary gland is seen to hypertrophy in pregnant women. So the size is not equivalent to a non-gravid uh, woman. So that increase is said to be about 50%, 40, 50% increase in size because it's a very small organ, very small, like the tip of the little finger. Maybe that one is even too big. Yeah, it's quite small organ, just like a bean seed that increases in size. So even the weight also increases. So because of that hypertrophy that occurs in the pituitary gland, then you expect also production to increase both in the anterior and the posterior pituitary gland. Of course, I expect that you know the type of hormones produced in the anterior and the type of hormones produced in the posterior pituitary gland. So posterior, looking at ADH and oxytocin. So oxytocin production begins now throughout pregnancy. Production will be there, but in non-gravid, production is 0 to just little amounts of oxytocin. Then we have other hormones of the anterior pituitary gland, prolactin, follicle stimulating hormone, luteinizing hormone, and what have you, which of course are regulated under negative feedback by estrogen and progesterone during pregnancy. So because of that continuation or continuous production of oxytocin, which was not in sufficient amounts prior to pregnancy, you find that there will be some increase in tonicity of the uterine muscles because they are responding to oxytocin. Once in a while, you may have short duration of minor uterine contraction, what are called Braxton Hicks contraction. Those are false contractions, are not a true signs of pregnancy. So that's under hormones. Other hormones that you expect to be present during pregnancy, you look at human chorionic gonadotrophic hormone, which is produced by the trophoblast. This is the outer layer of cells. Remember, during fertilization, it's just the sperm cell and the ovum that fuse, then form one cell, which we call a zygote. But it's actually having two nuclei and two genetic material from mother and father. Then that zygote divides into two cells, 4, 8, 16, 32, and so on and so forth. Now, later on, fluid accumulates in that, but the outer cells form the trophoblast and attaches to the uterus and begins to produce human chorionic gonadotrophin. So within the first 2 weeks after fertilization and subsequent implantation, you may find this hormone, HCG. So some comes early, 6 days after implantation, others 9 days after implantation. And that hormone can be now detected in urine during a pregnancy test using a test kit. Estrogen progesterone continues. Okay, so estrogen increases vascularity in the uterine muscles to enable formation of the placenta. And then progesterone, like we all know, maintains pregnancy to maintain the endometrium so it doesn't shed off and cause a spontaneous abortion. You can also add in another hormone called relaxin, which essentially works on the pelvic ligaments. So towards the term, the amount of relaxin increases in blood and that relaxes the ligaments of the pelvis, making the joints of the pelvis to be more flexible and allow childbearing. So that's under hormonal. So we've talked about changes or increase in production of hormones, we are seeing the shape, the size of the pituitary gland increasing, therefore increasing production of oxytocin, which works on the uterine muscles, and we're looking at new hormones, for example, human chorionic gonadotrophin, which may not be there, which should not be there if the woman is not pregnant. Estrogen, progesterone will be there, but in varied amounts, depending on the phase of the cycle that a woman is in. But during pregnancy, of course, progesterone and estrogen will be present. Of course, both hormones being produced by the corpus luteum. So maybe that is worth mentioning as well, that the corpus luteum will be sustained for about 2 weeks, 3 weeks, until the placenta is formed, which takes over now, producing progesterone and estrogen to maintain the pregnancy. So that is very, very important to mention. If you look at the urinary system, changes that occurs in the urinary system. So during pregnancy, you see that there is a increase in the size of the renal pelvis. This refers back to your anatomy and physiology. The renal pelvis is the first part of the ureter. So we have two ureters, left and right ureter. So that part is wide. Okay, but in pregnant women, it becomes even more wider. Okay, so it dilates. And therefore, you see this woman, visiting the restroom frequently. Okay, then there's also relaxation of the smooth muscles, of course, in the ureters, urinary bladder, in response to progesterone. That is why now you see that the bladder cannot, the sphincter muscles, the internal and internal urethra sphincter muscles cannot hold urine for too long. The pelvis, the renal pelvis is dilated, more urine being channeled to the bladder muscle itself relaxed, then internal and external muscles, urethral sphincters relax in response to progesterone. So there will be increase or frequency of micturition. So woman visits the restroom frequently. Now, because of changes that are occurring in the cardiovascular system as well, you are going to find that there will be slightly, you may find presence of abnormal findings in urine. In normal cases, we don't expect to find sugar or amino acids or proteins in urine, but if you do urinalysis, you may find such. So you find that the glomerular filtration rate is affected and tubular reabsorption equally is affected. So those first two processes of urine formation, filtration, which occurs in the Bowman's capsule, and then we have reabsorption that takes place throughout the proximal, loop venli, and the distal convoluted tubule. So it's not so effective in reabsorbing all the useful elements that were filtered during filtration. So some of the amino acids, some of the proteins actually, and glucose, vitamins will be found in urine. So if you look at the skin, so under the skin here, you may find the following changes. You find what you call the easiest one and the common is that you find the linea nigra. Now, there's what you call linea alba. Linea alba is where the six-pack muscles meet, midline. If you draw a line cutting through the body vertically into half, that's where the linea alba is. Of course, running through the abdomen and there at the xiphoid process. So there's hyperpigmentation of the linea alba, leading now to what you call linea nigra. So there'll be a dark line, of course, extending from the symphysis pubis, climbing up towards the xiphoid process. So in the early stages of pregnancy, it is just between the umbilicus and the symphysis pubis. Later on extends up to the umbilicus, above the umbilicus, and towards the symphysis pubis. Next, you're going to see stretch marks, or what you call striae gravidarum, because of the growing fetus, growing uterus, and that stretch that is accompanied with stretch and pulling of the skin. So you see that connective tissue under the skin separates and leaves those stretch marks. So you see some hypopigmentation. There will be more lightish or darkish in color than the other parts of the skin. Then there's what we call claosma, which is the hyperpigmentation of the face, usually on the cheeks and forehead. So you see mothers, grandmothers, and so on. They can notice if a young lady is pregnant quite early just by looking at these signs. Other changes, you may expect them in the respiratory system. So as the pregnancy is growing, so you see positioning becomes a problem. Metabolic rate goes up because now this woman has to metabolize, nutrition faster for herself, her own cells and tissues, and for the growing fetus. So there's increased demand in oxygen. So the breathing rate, breathing pattern becomes elevated. So this is in response to hormonal changes. When it comes to the digestive system, number one, most importantly or most commonly, is changes in eating habits. So appetite, sometimes there's increase in appetite, sometimes there's reduction in food intake. So it keeps on fluctuating. Then woman vomits. So some who vomit when they ingest certain types of food, others is random or continuous vomiting, which becomes a problem, what you call hyperemesis gravidarum. Okay, mainly associated with twin pregnancy. So vomiting, nausea, and fluctuating appetite. Then you may see other changes like pica. This is inclination towards certain type of foods, maybe soil, lemon, and what have you. That is in an attempt to acquire necessary nutrients, vitamins, and minerals for the growing fetus. So these are some of the issues that we should be able to raise under physiological changes during pregnancy. So what is important when such question comes is each explanation you're going to have, there must be a subheading. Oh, now I'm looking at a cardiovascular system. You explain there is the increase in heart size. So the heart undergoes some hypertrophy, some blood pressure may be elevated to some extent. Filtration of blood increases. Now you're going to the endocrine system. You list up points like that. So you don't have necessarily to raise 5 points on each or 4 points on each subheading, on each system. No, just raise enough. 3, explain nicely. You get all the full marks. Okay, but in an event that you have enough time, you can even reach 4. because you're fighting for marks. So I don't want you to be so brief again. This is an exam, so you must raise points because points depend on how much you have raised again in the exam. So avoid being too brief in your answering of these questions. So looking at what came, I thought it wise that we look at the physiological changes that occurs during pregnancy. There are quite many. I'll send some more so that you can quickly go through, just have an idea of what is happening. So that is very important. So we looked at the management of first stage labor. Today, woman was still in first stage labor. So that can be repeated, or they may bring second stage labor. And actually, they wanted you to open a pathograph and manage that woman. So some questions are not coming out clearly to say the woman is in first stage labor. It's up to you, your own knowledge, to know that this woman is in first stage labor because they are mentioning to say the woman is at 2 centimeters dilatation, 5 centimeters dilatation. You must know that this woman is not fully dilated, so they are still in their first stages of labor. Or they say woman has reached 10 centimeters cervical dilatation. Now, you know, she has entered second stage of labor. So another area we must look into, looking at what has come so far, because labor is gone, abortion is gone. Yeah, I was thinking we haven't seen puparium yet, so I think that is worth looking into. Puparium, you're looking at managing a woman after she has delivered. What are we looking at? What are some of the issues that this woman will need so that she has a healthy baby and for her own health as well? So that is very, very cardinal.